Hi, hello, live. I just realised that that wide view made me look fat, so I'm going to go a bit closer. Hi, Jonathan Stiano here. We're live. We're building an audience for you. Got some questions to be going through here. If anyone is out there, while Facebook is telling me they're building an audience, if an audience is there and they have a question, then they are more than welcome to personally engage and ask the question on a live basis, and I will do my best to answer it. First of all, I want to check if Camilla's out there. I'd like to say thank you, massive thank you for the positive review. It's great to get such positive reviews. We're very lucky. We've got a lot of positive reviews, and I think one of the reasons for that is something that I'm actually giving a talk this weekend at Olympia to the Plastic Surgery Association, the UCARPS, about private practice, building a private practice, managing a private practice. And I think one of the things that I stress to people is buonasera, is that the importance of looking after people. We all get complications. It's a nature of the job, but and we may have unfavourable results. But it's how you look after people, and something that we really try and do is look after people. And so we're very lucky that we have a lot of very positive feedback and positive reviews, because I think that's something I really struggle to do. Not struggle to do. I don't struggle. I do it. Sorry, I'm wobbling because my hand's wobbling. I've got a tripod for this, but I keep on forgetting it. So I don't. Yeah, there's something we work hard to do. Make sure that everyone's happy. So great, Camilla. Thanks for that. And I hope that we've actually answered your question from last week about the Mentor implants. I think Laura's been back in touch with you, so I hope you're not going to come on live and say that I haven't got back to you. Because I think we did, and it's like there is a website for Mentor, and you can register your implants with them, but you don't have to, because I've got the details. I electronically log every serial number of every implant I put in. A lot of surgeons, and I used to just have a sticker on the op note, and so if there was a problem with the implants, you have to manually go through every single case. But I've now got an electronic log of every serial number. Oh, there you are. So if you do need to, if there is any problems with your implants, I've got a log. But if you want to register with Mentor, then fine. But thanks for that, Camilla, and hope we've answered that one. So we've got a question from Maria. Maria's having surgery shortly and is asking about Arnica. It's absolutely fine to use Arnica. A lot of people rate Arnica and think that it is good. It's proposed to stop or reduce bruising. I don't particularly recommend it to my patients in that I don't tell them about it. I don't tell my patients to take Arnica. But if someone comes to me and asks, can I take Arnica? I say that's fine. There's not a huge amount of bruising in most of the operations I do, except maybe liposuction, maybe fat grafting. I guess there would be a bit of bruising in those situations. But nevertheless, I don't think it does any harm. So if you feel like you would like to take it, that is absolutely fine. Maria, please go ahead and take the Arnica and see how it goes, and we'll just see if it helps. Bra and medication, what's included? We've been getting a few questions, I think, about this for some reason. Sometimes you get fits and starts of the same question. Is it hurting my hand? Sorry. How do I normally do it? Oh God. So bra and what's included. So bra, it's this. I think these questions have come from other people. Does my hair look like that? Blimey. Maybe it's the angle. I think my hair does look a bit sticky uppy. It depends on who's doing the surgery, so you need to ask your surgeon about what's included. Bra's not normally included. I think I do include a bra. I used to say to people, bring a sports bra, and they always used to say to me, what size? And I'd always used to say, I don't know, bring a few, keep the labels on. But I always thought that wasn't great, so I now do provide a bra. So you come back from theatre wearing a bra if you're having surgery with me, but check with your surgeon, because it is not, it's usual. I think most surgeons ask you to bring a bra. if you're having tummy tuck or like a gynecomastia surgery, most surgeons will provide a garment, or usually two garments. So you do usually get a compression garment if you're having liposuction or tummy tuck or body contouring surgery. But for breast surgery, I think you're normally expected to bring a bra. But if you're having it with me, I'll provide you with a bra. Medication. What medication is included in the cost of this cost? So they are most cosmetic operations that are on what's called a fixed price package, which means you pay one price, and if you have any problems or anything like that, that's all included. So if you need to stay in hospital, or if you need to go back to theatre for any reason, then that's all included. The medication wise, your take home medication, I think it's I should have checked this, shouldn't I? I've just been at the hospital. I think it's 2 weeks. I'm pretty sure it's 2 weeks. They give you 2 weeks medication. I've got to say, most of the operations I do, it's usually painkillers is all that you need. And I go with simple things like ibuprofen and paracetamol, which can be bought over the counter. I think we do give you stronger painkillers like cocodamol, codidromol, codeine phosphate, those sorts of painkillers. But I always advise caution with those because they can cause problems like constipation or what have you. But I'm getting off track actually. What's included? So yeah, 2 weeks of medication is included. And if you did need antibiotics or anything, that will be included. I think to 2 weeks worth. If you needed longer than that, then I think you'd have to go to GP or pay or something, I guess. I'm not sure. But no, well, never say never, but you don't really need longer than 2 weeks medication, I would hope. And it's usually just painkillers. That's that one. Under the muscle, loss of volume. Some people do say this, that if you put breast implants under the muscle, you lose some volume. They sort of squish the implant, and which may be true, but I don't use that I don't put that in factoring in the size of implant I'm going to use. There's so many variables when you're looking at implants. That's just, it's not a significant enough change in the volume to make me make a decision. I wouldn't like get a bigger implant if I was putting it under the muscle or anything like that. Mostly because the main thing I go with when I'm looking at implants is the width of the implant. So the dimensions of the implant have to be right. So the width has to be right. The projection have to be right. I always make this big fuss about the volume's not that important, and I do think the volume follows from there. So I wouldn't, the width and the profile, what else? As you could argue, go with a higher profile if you went under muscle, but I don't say that. I don't say go with a higher profile. I think it does squish it a little bit, but I don't think it's, hi Gemma, thumbs you up. Is that right, did it? Hope no one heard that. So yeah, under the muscle, basically just go with the right dimensions, and don't worry too much about it. It's going to squish it a bit if it's going to go under the muscle. If you need it under the muscle, have it under the muscle, and go with the same volume that you would have gone whether you're going to have it on top of the muscle, is my advice. But that's just my tuppence. But then I guess that's what this is, my tuppence, isn't it? I suppose take advice from other people if you're seeing other people. We've got also a question here from Lee. How long off work? I'm assuming it's breast augmentation you're thinking of, and you're a I haven't written it down now, but care assistant or care worker. Right, week, definitely. After a week, I'm going to open this up to generalization because we've probably got other people might be interested in this answer or question. A week, you won't feel like doing much. After a week, you'll be doing stuff. If you're working from home, you can do it from home, typing and things like that. Okay, after a week. Driving, normally 2 weeks, I say. You might be okay after a week, but 2 weeks is probably safer. I don't know, Gemma, I don't know what you might say, more than 2 weeks. I don't know how you're getting on. How are you? 2 weeks now? Or anyway, sorry, digressing. But yeah, week to 2 weeks for driving. After 2 weeks, you should be able to get back into things like light duties, phase return, care worker sounds pretty, or care assistant, I think it was. But whatever it was, it sounds pretty. Yeah, 2 weeks. That's a good question, Rebecca. Thank you for that, and I'm definitely going to answer that. Week and a half, yeah. Um, I can give you a sick note if that's helpful. Well, I can give you one, Gemma, but also Lee, who is asking the question. Um, to say phase return after 2 weeks, I just write surgery on it. It's up to you to discuss with the employer if you want about what surgery you've had. We can get into that, and that's a whole nother thing about whether people feel guilty about this sort of surgery. But anyway, that's another issue, which I think you shouldn't feel guilty about this sort of surgery. But anyway, so yeah, after 2 weeks you start driving and things like that, but you will be phase return 4 to 6 weeks for any too heavy. So if you're heavy lifting, handling, picking people up, moving people about, at least a month, probably 6 weeks, and even then, just, you know, it's still going to be a bit swollen, it's still going to be a bit uncomfortable. You might want to take it a little bit easy. So I know it's a big thing to say take a month off work or 6 weeks off work, so maybe if you could do a phase return or a light duties, that might be the answer. But yeah, that's the normal schedule. The other thing that I would say to you, Lee, is that we put you in touch with people who've had it done before if you want us to do that, because a real person can sometimes answer the question better than me, because I just talk in general terms. Mind you, the real person might have had a particularly good or a particularly bad experience, so might not be representative. But anyway, put it in the mix and make a decision. Well, not make a decision, make a view on it, because that's what it is with life, and that's what it is with a lot of this stuff. You just have to make the best decision you can at the time. We have got an awesome question here by Rebecca. That is awesome. That is what if I could do more than a thumbs up for that, I would. I think I've just unthumbsed it up by trying to do 2. So I'm do 3, and just that's an awesome thumbs up from me, because we've got a live question coming in. So I'm going to discard my extensive list of questions, throw it away. Well, I'm not going to throw it away. I've done it, actually. I've completed it. That was it. So Saved by the Bell. Rebecca, hi. Wanted to know, where would you have surgery? Would it be in Birmingham? Also, how long would surgery be for a breast uplift and implants removed and replaced as have capsular contracture? Okay. Yes, I do work in Birmingham. I would always say, talk about this in my book. Should have a copy here to promote it, but I haven't. What's that? Oh, that's a magazine. Okay. Should have copies lying around the place. I do think you should have surgery locally. I work in Birmingham. You might see I've also got a clinic in London. I'm scheduling down my London. I've got a surgeon in London that sort of works with me. So he does the surgery because he lives in London and works in London. Because when I see people in my clinic in London, I still operate in Birmingham, but I do tell people to look for surgery close to home. I do advise that, and I think I do see people from far away, but I always say look for surgery close to home. And if you get a good, reputable, fully trained plastic surgeon, they should be able to work in any hospital. So they should be able to work in the local hospital. So I can work in any hospital in the country. So there's loads of hospitals in Birmingham. I've got practicing privileges in most of them. I've got practicing privileges in Little Aston, in Parkway, in Droitwich Spa, in West Midlands Hospital, Westbourne Centre, Priory, Parkway. Yeah, I've got practicing privileges, well, probably not most of them, because there's actually loads more than that. But anyway, I've got practicing privileges in loads of them. And I can work I'm trying to narrow down. I used to be travelling around all over the place. I'm trying to do less of that. So I'm trying to focus my practice a bit now. So I mainly work at Priory and Parkway, Priory and Edgbaston, Parkway and Solihull. So those are the 2 hospitals you'd have your surgery. And I don't do the surgery in my clinic. I do local anaesthetic cases in my clinic, but I don't do the sort of big ops in the clinic. So and this is a big op, what you're talking about there, Rebecca, breast implant removal, replacement and uplift. That is quite a big op. So surgery would be in Birmingham, as I say, but Priory or Parkway. And I think if you do have surgery, I would advise you to have it locally if you can. There's lots of good surgeons in Birmingham, and wherever you live. You're probably going to tell me you live in Manchester now, but if you do live in Manchester, I would say there's lots of good surgeons in Manchester and have it done in Manchester. But so yeah, look for a surgeon who works locally. A lot of some places will make you go like to Manchester or London or something to have surgery, because that's where their hospitals is. Oh, Oh, Solihull, there you go, perfect, Parkway. And you've got to think, why are they making you go to, oh no, yes, okay. Um, yeah, thanks, Lisa. You got to think why. Well, there's two things there, Lisa. There's two reasons why people go far away from home for the surgery. One is because the place might say, "Oh, our hospital is in London. We only have a hospital in London," and the reason for that is that the surgeon often the surgeons can't work in the local private hospitals. They can't work at Priory and Parkway. In order to work at Priory and Parkway or any of the big hospitals like Spire and Nuffield and BMI and all those ones, you have to be a consultant in the NHS or have been a consultant in the NHS in order to get practicing privileges at those hospitals. So when I talk in my book, Never Accept a Lift from Strangers, there's loads of cowboys doing cosmetic surgery and people who aren't trained and people who've got not trained in plastic surgery, not trained in anything doing surgery. Actually, those the main hospitals like Spire, BMI, you can't work there unless you are fully trained. So if you go to your local hospital, private hospital, you will be assured of having a fully trained private plastic surgeon. So I would worry if the surgeon said, "Oh, you've got to come to London to have surgery," unless that's because that's where he lives. Like me, I live in Birmingham, and that's why you've got to come to Birmingham to have surgery. Making sense? If you've got to go far away for the surgery, I'd say, well, why can't I have it done in Parkway because it's down the road? And the answer might be that their surgeon can't work at Parkway because they haven't been a consultant in the NHS or R1. But that's again a lot of big topic there. Big topic. Could talk about that one. So, and there you go, Lisa. Only go abroad because of the cost and not always about the surgeon. Yeah, and I totally understand that. I mean, it's a lot cheaper abroad, and I understand why people do go abroad, and they think, oh, I'll have a holiday at the same time. And I completely understand it, and it is a huge industry, and a lot of people do it, so it can't be all bad. But I would advise against it. The problem with this sort of thing is that there's often minor issues, and there could be major issues, and it's a bit like insurance. If you don't have to claim, then you're fine. But you have to claim, it can be a bit of a palaver. So just have a look if you do go abroad for surgery. I know you're not saying you are going to go abroad for surgery, but it gives me something to talk about. So I'm going to talk about it. If you do go abroad for surgery, just think about what is going to happen if you have a problem at 10 o'clock at night on Saturday night after you've had your surgery and you're back in Solihull, and the surgeons abroad. So, what are the follow-up channels? And if you have to go back to theatre on, 3 o'clock on a Sunday afternoon, which theatre are you going to go to? Because I think a lot of them rely on the NHS. A lot of them rely on you going to A&E, and that's not going to be great. Having to walk into A&E saying have, a tummy tuck in Bratislava or somewhere, I don't know, somewhere abroad. I shouldn't mention anywhere because I don't want but somewhere overseas. And so that's number one problem. Number two problem is the training is different. The training is different in every country. Some countries have like a professor in their hierarchy, and the professor and all the other surgeons are underneath the professor. And so they're not trained to the same level as we are in the UK, because once you're a consultant, there's no one above you. You're fully trained and fully independent. Similarly, some countries, they train to different things. Plastic surgeons can train to different levels, and they do different things in different countries. I'm making that clear. It's all in my book, this. So the training is at a different level. The fact of the matter is, all these countries will have great surgeons, and they'll have, they'll have the spectrum. They'll have good, bad, and indifferent, just like we've got in this country. But it's just knowing what to look out for and knowing what level of training they are is a little bit more difficult if you go to an overseas place than you go here. So two problems with going abroad. One is if you have a problem at 5 o'clock in the morning, and second is what was the second one? Oh yeah, surgeon training and live. Just look at that. Camilla has come in. I mean, that is, I'm just going to thumbs up this because that is awesome. Camilla, how can you know it's first signs of capsular contracture? Camilla, I can't believe you're asking that question, because how you are like, what are you? days after surgery, isn't it? It's days. Um, right, Ada, thank you for that. Excellent. Right, Camilla, take that question back, please. When can you notice first signs of capsular contracture? She's asking. I don't know how many days, but we can measure it in days, can't we? The time, your post-operative course. I hope you're just asking that question for the benefit of the others. Capsular contracture is something that takes years to come, and you notice it by a hardening of the implant. The implants, the natural progression of capsular contracture is that it starts to feel hard, you start to feel the edges. Then as it contracts more, the implant becomes more globular, more sphere shaped. Yes, 6 weeks, yeah. Okay, maybe not day. God, is it 6 weeks? Blimey. Okay, maybe it's weeks. But then it starts to look a bit more globular. You see the outline of the implant, and then it gets uncomfortable. That's the natural history of capsular contracture. And if you're anywhere along that line, I always say leave it as long as you can, because it's a progressive thing. Capsular contracture is a progressive thing, and if you change them, then you're going to get capsular contracture in the next one. So the longer you can leave it, the better. But we're looking at years, Camilla. I will keep an eye on you. I will not discharge you. I will look after you. I will offer you, once we've done them, we normally do appointment at 1 week, 6 weeks, 3 months, 6 months, and then yearly. So I offer all my patients yearly follow-up to keep an eye on these things, and there'll always be an open appointment, so you can always come back. But don't worry about that yet. And I know you're not worried about that yet. I know you're just asking the question. So massive thumbs up for the question. But yeah, don't worry. But it's the other thing about capsular contracture is that it that's really quick, Rebecca. 2 years. The other thing about capsular contracture is you only have to do something about it if it's a problem. So, you're often guided by the patient. If the patient doesn't feel like there's a problem, there isn't a problem. If the patient feels like there's a problem, there is. So, I offer yearly appointments for people to come back, but you don't you don't have to. And I know you're not worried. You don't have to come back, and you will notice it yourself. And if you don't notice it, then it's not a problem. I'm scrolling up because these questions, this has just gone absolutely viral. This is virality for you, these questions. Right, Ada, always wanted to, and then Ada and Rebecca, we got them line up, stack them up. Always, I'm going to need a PA for this next time. Always wanted to increase my breast size, but I'm afraid that I might not wake up afterwards. What assurance can you give me? Ada, very, very common concern. And you know what? I think I would be worried if I had to have a general anaesthetic. So, first of all, you're in good company. A lot of people say, I'm afraid I'm going to wake up. Oh, sorry, I'm afraid. Well, they either say, I'm afraid I'm not going to wake up afterwards, or they're afraid they're going to wake up in the middle. Those are the two sort of things that people fear. And what I would say to you is it is very, 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 very unlikely that you'll have a problem. First of all, if you're really worried about an anaesthetic, this sort of thing can be done under a local anaesthetic, although it wouldn't require sedation, so you could be sedated. So you can do it under local anaesthetic and sedation if you're really worried. But if you're the other option is, the first thing I would say is that you can talk to the anaesthetist beforehand. Thanks, Gemma. That's very kind of you. That's what we need. And Gemma is a real person. It's not just my wife in the other room putting in a comment. That is a real. Thanks, Gemma. That's an idea. Get my wife in the other room to put in good comments. No. Right. So, yeah, you can talk to the anaesthetist, and you can. What I normally tell people, I don't know if this is helpful or not, but I tell people that probably your journey to the hospital is more risky than the anaesthetic that you're having. So in the same way that I cannot give you an assurance that you will not die in your car on the way to the hospital, I cannot give you that assurance. I cannot give you a guarantee that you will not die in a car accident on the way to the hospital. But what I can say is you're very unlikely to die in a car accident on the way to the hospital, and it will probably be absolutely fine for you to drive to the hospital for your surgery. But I have to use the word probably because, people die on the road. In fact, people die on the roads a lot more than they die in hospital, certainly for this sort of stuff. Now, if you're talking about the NHS, if you're talking about open heart surgery in old people, in people with cancer, in people who are ill, then it's more common, but it's still not that common. In elective surgery, which is planned surgery in fit young people, I'm not going to say it never happens, but it's like really, really rare. So that's probably the best I can give you, Ada. But you know, I would say don't let it. There are things to worry about if you're having implants. Infection, there's a scar. You might be able to feel the edges, stuff like that. There's all sorts of things to worry about. Not waking up after surgery is not one that I would particularly worry about. Although I'm just contradicting myself because I think everyone is naturally worried about it, but it's not one I would make it change my decision on whether I have it done or not. But it's totally understandable. And if you're really worried, then you know, just don't have it. You've got to balance it up. You've got to balance. It's a balance. All this stuff's about the benefit of having it versus the risk of this worry that you might not wake up. And if the risk is if you're really worried, then you don't have to have the surgery. But if you really think that you would benefit from having the surgery, then have it. But talk to us, basically. Talk to us, and you can talk to the anaesthetist, and you'll be absolutely fine. I'll tell you that now. But it's totally. Well, that's reassuring. The anaesthetist said it was too much paperwork for you not to wake up. That's Dr. Aurora, isn't it? Yeah. So yeah, I mean, I regularly use the same anaesthetists. The anaesthetists work in ITU. They're all NHS consultants, or have been NHS consultants, because, as I say, they wouldn't be able to work at that hospital if they weren't. I know them. I've worked with them for years, and you know, you will be fine. But it's a totally reasonable thing to worry about. What we got here is I had surgery in Bromsgrove. Was not impressed with the aftercare. I wouldn't travel far as I need assistance after. I would want to be able to go back quick. Plus, I have 4 children to look after. Between cosmetic surgery and plastic. Yes, Rebecca. God, these questions are like I've written them, which I clearly haven't because I'm here. There is a difference between a cosmetic surgeon and a plastic surgeon, and cosmetic surgery is not a surgical specialty. It's not a recognised surgical specialty. There are certain surgical specialties. So when you become, you train in medicine, you do 6 years in medical school, then you train in surgery, you do like 2, 3, 4, 5 years to be a surgeon. And then once you become a surgeon, then you train in a specialty. So just being a surgeon, which is FRCS, Fellow of the Royal College of Surgeons, or MRCS, is not. Being a fellow or member of the Royal College of Surgeons sounds good, but it's actually quite a basic qualification. It's not a specialist. You then have to do an extra 6 years. Well, in plastic surgery, it's 6 years. 6 years training in plastic surgery. So plastic surgery is a defined surgery, and oh, hi Claire, long time no see. A defined surgery, and it's a just defined speciality. So there are certain specialities: ENT surgery, plastic surgery, general surgery, maxillofacial surgery, orthopedic surgery, eye surgery, whatever. These are cosmetic surgery is not one. Cosmetic surgery is just a word that people use, and there are lots of different people who do cosmetic surgery, and it is fine for lots of people to do cosmetic surgery. It doesn't have to just be plastic surgeons that do cosmetic surgery. There's no problem with other surgeons doing cosmetic surgery. For instance, an ENT surgeon, ear, nose and throat, might do nose jobs, which is a cosmetic operation, or they might do ear, sticky out ear pinoplasty operations. That's perfectly reasonable. That's cosmetic surgery. It's an ENT surgeon. That's fine. The point that I would make is that you need to see what training your surgeon has got. So a cosmetic surgeon is like, what does that mean? That's just a term. You know, we call ourselves cosmetic, but are they trained as a plastic surgeon, or are they trained as an ENT surgeon? What is their training? Because you might find that some don't have training in anything. But you have to do the research to find that. They can still call themselves a cosmetic surgeon. You know what? People call themselves plastic surgeons, even though they're not trained in plastic surgery. What's going to happen? There's no law. You're not going to get, arrested for it. So people call themselves stuff all over. I get people saying, oh, my plastic surgeon this, my plastic surgeon that. And I said, oh, yeah, who's that? What's his name? And they say, whatever, Joe Bloggs. And I'm like, well, he's not. I know the names of pretty much all the plastic surgeons because there's not that many of us. And I'm like, well, he's not a plastic surgeon. So do your research. It is important. as I say, it's fine if they're not a plastic surgeon, but they should already be trained in something. They should be on the specialist register with the GMC. Hold on a minute, they're coming in now. So yeah, look for someone who's fully trained on the specialist register. Well, it doesn't have to be plastic surgery, as I say, in a specialty. Right, what we got here, we got Claire, we got Louise. Claire, I had my surgery at BMI Droitwich just over 3 years ago. I'm currently 7 months pregnant. Will my breasts return to how they were post-pregnancy? I hope so, Claire. I really do hope so. I can't guarantee it, but I hope so. Enjoy your pregnancy. And what will happen is they'll get bigger. Obviously, well, as you will find, they'll get bigger. Then you breastfeed, they're becoming gorged with milk, and then they'll get smaller again. Well, what I always say is it's unpredictable what happens to the breasts after having children. It is unpredictable because they might get bigger, they might stay big, they might get bigger and then get smaller, and they might go smaller than what they were pre-baby, or they might get bigger and go back to the same as what they were pre-baby. And if they do get bigger and go smaller, sometimes they can droop because the skin's been stretched. Sometimes not. Sometimes it retracts. So, sorry, I'm being a bit vague, but basically it's unpredictable what happens. Bottom line, enjoy your pregnancy, enjoy everything, see what happens. If you do consider having anything done, I'd wait a minimum of 6 months, ideally a year after having your child, before thinking of having anything done. By all means, come on down and see me. And we can talk about it, but yeah, see how it goes. But give it a year to retract. The skin will retract. There will be a degree. And the other thing is, how many have you got? I don't know. Have you got children already, Claire? So the more children you have, the more they get stretched. So yeah. So let's see how it goes. Louise, I had mine done with you when you worked for the NHS in 2009. They were fantastic, but since having my son 5 years ago, they have capsulated, and now the NHS won't do them. How much would this cost to replace them? Is that right? Yeah, I think you're right. The NHS, that's bad, isn't it? Because I did it when I was in the NHS, and then they're not doing it. I'm sorry about that, Louise. Well, sometimes what the NHS says is they'll remove them, but they won't replace them. I don't know if they said that to you, but sometimes they say that, which isn't great, is it? Sorry about that. So when you worked in the NHS, it was 2009. So how much? That's 2000. So that's 8 years ago. So my advice always with capsulation is leave it as long as you can, because it's going to progress, and the longer you leave it, the better. But if you do want to have them, how much will it cost? I don't know. I think it starts with six. I think it's 6,000. I think it might be nearly £7,000, Louise. I'll tell you what I'm going to do. I'm going to get Laura to contact you tomorrow. She can do a Facebook thing, I guess, because you're here, about the cost. And she'll tell you the cost. I'm afraid it's an expensive operation having the capsules removed. Was I supposed to talk actually back there, Rebecca? Was I supposed to talk about removing capsules and lifts as well? That's a big op. Was there a question there about that? I remember it was, is it in Birmingham? How long was, also, that's right, how long would surgery be for a breast uplift and implants removed? So how long would that be? So Rebecca, I'm going back to your surgery. How long? So capsulectomy and implant replacement is a big deal. It's bigger, much bigger. Like a breast augmentation takes about an hour. Capsulectomy and implant replacement takes about 3 hours. So it is a big deal. You have to remove all that scar tissue. I often use drains, which I don't for the initial surgery. I was going to talk about drains in this one. Blimey, I have to do that next time. I think I've gone on too long here. Can't believe you guys are still around. Didn't expect this. 3 hours for a capsulectomy and implant replacement. Capsulectomy, implant replacement, and a lift. 3.5 hours. 3.5 hours. A lot. 3.5 hours. It's a a long time. I'm not saying the lift doesn't take any time, but it sounds like the lift doesn't take any time. It does. So 3.5. It sort of comes in. But yeah, 3.5 hours. I'm saying for that. It's a long op, basically, Rebecca. Big deal. General anaesthetic. Probably. Overnight stay in hospital, and so it's a big op. So Louise, so again, big op. Ada's already got 4 kids. So Ada, you're worried about not waking up. Yeah. You've already got 4 kids. Yeah. Well, that's congratulations, and don't and ideally if you finished your family before having breast surgery, ideally we had that bit of, there's a post on Facebook about that, you don't have to, but Verity, hi Verity, nice to see you here. I know you. My breasts have started hurting, especially at the sides. I can usually lie on my side no problem, but now it hurts. You know what, Verity, it's quite a long time since your surgery, like I'm going to say 18 months or something, isn't it? It's a long time. Unusual for them to hurt, for the implants to hurt after this amount of time. If you've got a problem that's that long after surgery, I am well, two things. I guess capsular contractures there. Capsular contractures, it does hurt, but normally hurting is the last stage of capsular contracture. It's normally very hard by the time they start hurting. So I'm going to say it might well be something to do with your breasts. You've got to realise that obviously you've got breast tissue there, and breasts can hurt. No way, 5 years. No way. 5 years. Whoa. I never said it was 5 years. Kidding me. Wow. I mean, it could be capsular contracture, but the other thing is you've got to think about is breasts can hurt, you know, without implants in. So is it something else? So something to think about. If you're worried it's the implant, come back and see me, and I can have a look and see if you've got capsular contracture. And if it is, then we can talk about how we manage that. But the bottom line is I usually leave it for as long as possible. I have a 2-year-old now. Wow, God, it's crazy. What's happening? Anyway, I can't believe it's 5 years. Well, congratulations, Verity, and that's amazing. But yeah, by all means, come and see me, and we can just see if it's related to the implant or not. If it's not related to the implant, it might be related to your breast, and so that might be something to that. Like, well, that's what. Well, okay, well, that's the I was going to say hormones. You know, time of the month, things like that. So that's the other thing to think about. Is it a hormonal thing? Is there something going on with your breast that's causing the pain? Because people without implants do occasionally get breast pain, and breast pain is a separate issue. So the first thing is to see whether it's anything to do with the implants, and then maybe we need to look at investigating whether it's anything to do with the breast and breast pain. And rather confusingly, like a breast surgeon tends to treat breast pain, which is a general surgeon, not normally a general surgeon, not trained as a plastic surgeon, but that's something we can maybe get your GP to look at if it's not related to your implant. But if you want to come back, by all means come back, come and see me at Parkway, or come and see me have you seen my new clinic? I don't know if you see my new clinic, whatever, see you wherever, and we can look at whether it's the implants or the breast. Yeah, that's that. So it's good to see you on here. Look, it's good, this Facebook Live, isn't it? We can just do a consultation. You don't have to come back to the clinic. Amy, what you got? This is a life. I don't need questions written down. I've got questions coming in live. I stopped breastfeeding my daughter, only child, start of December, and I'm looking to have a consultation with you around March time. Is that too soon, or should I wait? Thank you. Absolutely fine to come back for a consultation. No problem, Verity. Should I get Laura to contact you, or you can just Facebook us if you want to make an appointment, Verity. Just Facebook us. No charge for consultations, however long. So by all means, come on down and I will see you, and we can check it out at Parkway, or come and have a look. I don't think you've been to my new clinic, so come to my new clinic in Edgbaston if you want, or at Parkway every Thursday. So yeah, just get in touch with Laura and we can sort that out. So Amy, stop breastfeeding your daughter at December. I stopped breastfeeding my daughter, and I'm looking to. The question I would ask, number one, is when did you have your daughter, Amy? So how long post delivery are you? Yeah, it's only been 3 months, isn't it? If you want to have a consultation in March, I only charge for the initial consultation, Amy. So you're welcome to come to the initial consultation at any time. But I think 3 months post. As you presume breastfeed for a period. I normally say the minimum amount of time. Oh, she's 21 months. Oh, okay. Oh, that's good. Okay. Well, in that case, yeah. Well, that's a couple of things. First of all, you've got to think, how old is the child? So obviously your child is old, so they're not like, you don't have to lift them up, and they're a bit more mobile. So that's a good thing. Obviously breastfeeding makes your breasts engorged, and then they get smaller. So you've got to give it time to recover. So that's basically what your question is asking. How long do I need to give it to recover? 3 months is a minimum to recover. Ideally 6 months. Well, I say ideally 6 months, preferably 6 months, ideally a year. But that's usually post-pregnancy rather than post-breastfeeding. So I can see you at 3 months. By all means, come, and we can always just say, see how you go. I probably will advise you not to have surgery for another 3 months, but you could always plan it then if you're keen to have surgery soon. If you're not that keen to have surgery, you know, if you're not desperate to have surgery, the longer you leave it, the better, because you see how much your breasts recoil, because there will be a degree of recoil, and there might be a degree of breast getting smaller and breast changing size. So if you're thinking of having any sort of breast reshaping, whichever way, you're best to do it when you're on a stable platform. So the longer you can leave it, well, not the longer you can leave it, but if you can leave it a year, then that would be great. You might say, oh no, I'm, you know, my lifestyle is such, or my work or whatever is such that I want to have it done sooner. Minimum will be 3 months. You know, 6 months will be better, but a year will be even better than that. So the longer you leave it, better. But by all means, you can come and see me at March, and then then I might say to you, look, why don't you come in another few months and we can see how you're getting on. And a lot of it you will know yourself. Your breasts, you might feel your breasts changing yourself, or you might say, you know what, they've been stable for 3 months, or the last couple of months. I think I'm ready to have some surgery. So you know, these are just ballpark figures I'm giving. So yeah, 3 months would be minimum, 6 months would be better, and 12 months ideal. And cue Alfredo. Alfredo, I'm live. I'll see you later. Go and get your pajamas on.
You know where Mum is?
Yeah, I think she's gone out. Freddie. Yeah, yeah, Freddie. I'm checking out of this. I'll be with you in 2 secs. And so yeah, that's that. Right. And so that's that then. Freddie, why are you not in your pajamas? That is that. And so that's Freddie. I am a professional. I'm a trained professional. I'm a trained professional. Go and get your pajamas on. And that's that then. Thank you very much. And I've got to check out now. My child is messing. Stop it. Right. Thank you. See you next week. I'm checking out. I'm checking out. Bye. Bye. Sorry if I didn't do that question very well. I'll do it again next time. Bye.